Okay, welcome to everyone who's joined us. Thank you for being here. My name is Erin Bader. I am the Director of Knowledge and Dissemination for the National Center for Adoption Competent Mental Health Services. And you have joined us for our August webinar, and I am excited to have Millie and Stacy here with us, and they'll introduce themselves here in a minute. But I just wanted to provide kind of some housekeeping tips, and then I'm going to do a very quick high-level overview of the National Center before I hand it off to Millie and Stacy. Next slide. So your standard housekeeping, folks, is that this will be recorded, and there will be a follow-up email sent out to you all with the recording. If you have any questions, please place them in the Q&A. We'll have time at the end, and use the chat to engage with us and with each other. Next slide. So the National Center started in October of 2023, and we are working directly with states, tribes, and territories to build cross-system collaboration between child welfare and mental health systems for the purpose of improving access to adoption-competent mental health services. You can also see, just to highlight, this slide shows some of the technical assistance offerings that we provide to states, both on the universal side and the intensive side. Next slide. Oh, there was an animation there. There we go. Those are just our 3 goals. So improved cross-system collaboration, equipping the workforce, and enhanced accessibility. It's always important with any project to kind of start from your why. Why was the National Center created? We were created to ensure that children and families who've experienced child welfare have access to the mental health services that they need, but services specifically catered to their unique life experiences and needs. And you can see we align change makers and child serving systems to collaborate in order to achieve this mission. Next slide. So you will hear me talk about, and the National Center talks a lot about adoption competence, and I just wanted to spend a minute to kind of clarify that even though adoption is in the name, adoption competence as a practice, as a modality, applies to any children and families who've experienced the child welfare system, because the unique experience of child welfare is very similar to those families who have gone through an adoption. You can see that a lot of these families experience separation and loss and grief, and the impact that those issues can cause throughout one's lifespan, and influencing identity and relationships and psychological adjustment. The most important piece is that adoption competent services are family focused. The entire family unit is involved in the services. They are strengths based. They focus on kind of reframing children's behaviors based on like what they're showing of the needs of that child, and learning about their experiences and how that impacts their current functioning. It is attachment focused and trauma informed. Next slide. So today, Millie and Stacy are going to talk about research that was done by FREDLA and other family organizations. And we created this piece of content to kind of summarize that research, but also apply it directly to the work of the center. These outcomes that they're going to review align very well with the work that we are doing and hope to continue doing within the National Center. Of, you can see kind of those common words again: increasing access to services, improving collaboration across systems, which improves the access to services, providing resources and knowledge, and improving the workforce. Okay, one second.
I am Millie Sweeney. I am with the Family Run Executive Director Leadership Association, and also FREDLA is a partner in this Technical Assistance Center. And so I'm glad that we're able to provide this information to you. I am a clinician by training, but most of my career has been using my personal experience, my lived experience as the parent of two children with emotional and behavioral challenges. And I do at FREDLA, I'm the Director of Learning and Workforce Development. So I do our trainings, I do our research collaborations, pretty much anything else that comes up. I love parent peer support, it's my thing. And through that, I was connected with Stacy. So I'm going to turn over to Stacy to introduce herself.
Hello, everybody. Thank you, Millie. I am Stacy Morgan. I'm actually Executive Director of the Mental Health Transformation Alliance, which is a family-run 501c3 organization. And all of my work and experience is through lived experience. I have um, I have three biological children, one adoptive child, and six grandchildren. But two of my three biological children have navigated services, and then, of course, I have navigated and still continue to navigate services even in the adult realm for my adopted child, who just happens to was also kinship placement, was my cousin. So all of my experience comes from expertise and through partnering with wonderful people like Millie.
Stacy, next slide. The information that we want to share today is based in a research project that we were a part of. It was awarded the funding was awarded to FREDLA from PCORI, which is the Patient-Centered Outcome Research Institute. And we partnered with 6 family-run organizations across the nation, including Mental Health Transformation Alliance in North Carolina, but also Pennsylvania, Mississippi, Arizona, Nevada, Washington, and then we had our research partners. We've partnered on a lot of different things, but from University of North Carolina, Chapel Hill, and University of Texas at Arlington. What we did is we wanted to find out what matters to youth, what matters to their parents, whenever they engage in behavioral health services, whether that was at school, with a mental health provider in a clinic, whatever way they access behavioral health services. And we did 2 rounds of focus groups with the family-run organizations, and they recruited the families and the youth across the nation. And we asked, what do they hope to get out of it? And we asked them to give their top 3 priorities. We came back around afterwards to clarify what we had learned from them. And did it fit? Was it in their language? Did this make sense? Were we interpreting this correctly? And then we also pulled priorities again. So we did a number of things along the way. It was a collaboration at every point where all of the family-run organization leaders were involved in every step of development, of implementation, and looking at what the results were. We also developed an infographic, a brief, and an articles out of this. Next slide.
So, like Millie stated, with the project being, we as family-run organizations were there from beginning to end. The equal partnership of this project ensured that from the start to the beginning, planning to implementation, and even afterwards, as now we present together to share these outcomes, that all of our voices were valued equally. There wasn't one over another. All the family-run organizations helped in the design, implementation, and the creation of the resources from the project. Our opinion in what it is we thought we hear from the families and the communities that we work with mattered at every point on this project. And our expertise was taken into consideration when developing the process, when recruiting, and when developing the products. And while the research guided that data process, we helped even with the simplest of words to make it be family friendly and family centered. There was collaboration allowed at every focus group, and each focus group was tailored to that community or that state's needs, including the timing, the format. There were stipends for the families and the youth, and that was tailored to the need of that family-run organization's populations that they serve. Next slide, please.
We learned some amazing things from this. What you're seeing now is the infographic that shows the top 10 outcomes that youth and families look for, what they want when they engage in behavioral health services. So you can see in the teal colored circle, that's parents and caregivers. Youth are in sort of the orangey color. And in the middle are the ones that they agreed upon together. The thing I really want to point out, and I'm sure you'll have this in resources that are shared or the slide deck that is shared, is that we learned it is the relationship that they have with providers that is important. It is the actual experience of engaging in and receiving behavioral health services that is an outcome for youth and families. So when they go and they do an intake, they decide even where they're going to go for behavioral services. Are they going to accept those? They go from the beginning thinking, okay, I'm a partner in this. And if they're not treated that way, then they're not going to come back. They're not going to finish programs. It is the actual experience, how they are treated, how they are partnered with, is their expertise respected and included in any kind of planning that makes a difference as to whether they reach the goals that they want to reach. It's absolutely critical that we think about the experience, not just the outcomes. I also want to point out that these are not necessarily things that we're researching. It's not things that we're evaluating in our programs, but we should. We should be looking at what is most important to youth and families when we are doing evaluations of our services, when we are researching how to inform and improve practice. Next slide. As I said, it is the quality of the experience of receiving those services. We also found out that youth want their parents to get just as much out of the services as they do. I think one young person actually said, I want my parent to not have to worry about me. I want them to have their own life. Because when, as parents, we sort of wrap our whole lives around our kids and making sure they get what they need. They want us to have a life outside of that, which I thought was really cool to say. Now, these outcomes, as I said, they're not being measured. Much of the research really focuses on clinical outcomes. They don't really look at the family. They're not looking at the level of engagement and partnership that's happening. It's more about what researchers think is important and what programs feel like they need to measure. And a lot of times that comes from what your funding source is or what is important to your organization. So I hope that after today and after you hear more information about how to facilitate these outcomes, that you really will start using them. Next slide.
So how this project and results resonate
Back
with
one.
Yep, back one. Resonate with me as a parent, as even, a biological parent and an adoptive parent. It resonates with me in the way that this project centers voices of families, which is something that is essential in both parenting and foster parenting or adopting. It recognizes that those closest to the child or youth understand their needs best and ensures that our experiences as a family drives those decisions, not the data. As a parent, the value in these outcomes that Millie just showed reflect real life progress, right? Like it would improve relationships, stability, and access to resources. They're not just numbers on the report. The information that you just saw it's real life. It comes from real lived situations. And as an adoptive parent, I know how critical it is that the systems adapt to meet the unique needs of each child and family. And this project focus on collaboration, their individualized reports, approaches, and respect for the lived experience makes that possible. This project will help others see the real needs and the outcomes that us as family and youth want to see. Next. So we are going to do Menti real quick, and I do not know if you guys have used Menti before, but you can either scan the code or QR code, or you can go to menti.com, menti.com, and enter code 36770367. I'm going to give you one more minute, and then Millie is going to, are you able to share screen, Millie?
I just did the request for that.
Okay.
Let's see.
So scan QR code or go to menti.com and enter in 36770367. And the question on that Menti survey is, to what extent do you think these outcomes that you just saw that families want, say that they need or want, are being achieved in your work and community?
It is actually a different
Okay.
code. What is on there?
Tell me code.
Oh,
Go
it
ahead.
is going to pop up. Hang on. There it is.
All right. So menti.com, we apologize. It assigned it a different code. Go to menti.com and enter in code 79260098. So if you didn't use the QR code, weren't able to use that, or if you're like me and technologically, a little behind, and you got to go to actually and enter in the code, it's 79260098. And we want to know, to what extent do you think what you just heard those us say are being achieved in your working community? And so we have about 12 that say somewhat, and then someone who says quite a bit. Okay.
I'm not sure what happened.
Are you there? Okay.
I'm here.
So I don't know if
Are
there's
you,
any.
are you seeing the results? I'm seeing the Mentimeter results.
I am.
Okay.
All right. Is there anybody else? Is there anything, even if you can't access the Menti, is there anything you want to put in chat that maybe, those of you that answered somewhat, what are somewhat of those ways? What are those ways? List some of those ways in there. And if quite a bit, why do you feel that's quite a bit? Go ahead and just list it in the chat. And if you want to. If you don't, and just so you know, all of these mentees are anonymous, so we don't know who's answering what. So somewhat, mostly through community mental health clinics. Okay. Anybody else?
I have to say, Stacy, that this is kind of what we see
Yep.
whenever we ask this question, is that there are some parts of this that people are looking at that are important to them, that they're evaluating, but it's not everything.
No. And sometimes it takes the whole package. I mean, this is what families and youth need to be able to engage, to be able to uh, access mental health services or support or resources. All right, I don't see anybody else, Millie.
I'm going to stop sharing that.
Okay.
We should be able to go back to the slides.
And next.
So there have been other people who have researched this. What you're seeing now is a compilation of 30 years of research into engagement with youth and families. And this is a complicated slide. I'm not going to go through all of it. But what I wanted to point out is that the research says that when you engage and you partner with families, you get positive outcomes, not just for the youth and family, but also for your agency and your staff, also for the system, for the community, and even managed care has better outcomes when you do this, when you partner with youth and families. Next slide.
So, to strengthen your work with families, you want to, on an individual program level, treat the relationship as a core outcome, right? You want to have a relationship as a priority, and it needs to be individualized. Um, it also needs to, you need to have program evaluation and continued quality improvement, or CQI. Use data to set clear, measurable goals and objectives to guide your efforts, and communicate those results clearly, consistently, and with purpose. Don't just share the numbers, show them in action in your work. As families, and even as individuals in anything, we like to see it, not just the numbers, but we actually like to see progress and things moving. Integrate those outcomes so into every level of your processes and protocols and partnerships, so that they drive decision making and improvement. And let this data shape both, let the data that you get shape both your program design and your staff development, to ensure that families have a meaningful experience and it has lasting impact on them. Treat those youth and families as active partners in treatment. They have expertise. Whether they're the bio family, the foster family, or the adoptive family, like I said earlier in our process, they're the experts. They're actually the one navigating the services. All right, next. So, what worked and what didn't work? So, kind of on this slide, I'm going to talk about my personal experience of navigating services for my biological children and my adoptive child. What worked for us was personalized support and services tailored to our family's unique situation, and it was built on trust and stronger outcomes. A family-centered approach meant we weren't just participants. We were actually there for being partners in the decision making and planning, and we were ensured timely access to resources, and we were able to meet both immediate and our long-term needs. On the other hand, there were challenges, right? Because as an adoptive family, there was lack of information on our part that left us feeling unprepared for accessing services. We also had some cultural disconnects between us and our service providers, which sometimes created barriers. And then that one size fits all approach did not work. Every family is unique, and our circumstances that we faced as a family were unique to us. And then, unfortunately, stigmatization, the assumption or bias about our family, the undermined trust and engagement. And when I say stigmatization of our family, I mean the experience that our family had when accessing services for my biological children versus my adoptive child were two different experiences, being that we had got my adopted child, but yet when we took him in for services, it was automatically looked at us as we're the reason he's the way he is and needing the support he needing. So stigmatization of our family, that, wow, you're here because he needs services because of the trauma that he had experienced in the past. So when I say stigmatization, I mean that which created untrust on our part of the person providing us support and resources. Next slide.
We're going to do another Menti. It's the same code that you went to before. So we're just going to the next slide about what are you doing now at the individual and the program level, and what are some other strategies that you can implement that really partner with youth and families and get to those outcomes at that individual level. So I'm gonna share my screen if everyone can use the QR code, or you can also go to Mentimeter and use the code 79260098. You can also just go to the next slide that pops up from, if you're using your phone, it should be there. Give a second for people to respond. If for some reason you can't access Menti, feel free to put it in the chat. Are you doing things now at that individual level to get to those outcomes to really partner? Okay. Oh, a post-adoption center for support and referral. Yeah. Because these family makeup is a little bit different. And Stacy, feel free to remark on anything that pops up in the chat too.
Someone just said some.
Expanding our list of mental health agencies in a planful way. It's always good to have more tools. Oh, I love that, and of course, this is from CASA, which is great. Thank you for volunteering your time in such an important way. Ensuring that the child's concerns are also addressed, because they may not be the same concerns as the parent has. They also should be engaged. Anyone else? This will stay open if you want to keep adding to it. And we will save this as a PDF, and Erin will send it back to you, so that if you want to share it as part of the resources from the webinar, you're welcome to do so. Stop sharing. We can go back to the PowerPoint. Okay, next slide. We also want to talk about the organizational level. And at the organizational level, to get to these outcomes, there are a few things that you can do. You want to make sure that there are options for families to be partnered with and to have input at all levels, not just the individual service feedback, but all the way up to having family members who've received services to sit on your board, to be part of your hiring practices. There are so many ways that you can infuse that family and young people information there. Partnering with family-run organizations is a great way to do that, because family-run organizations are built by families for families. And so they are experts at teaching people how to partner effectively, at being excellent partners, just like on our study that we did. You want to infuse lived experience into your organization and your programming. So that usually looks like youth and parent peer support providers. It's also support groups. It's also having a parent peer support provider maybe be part of your intake process, so that families are immediately connected with someone who has been there and done that and can help them move through the next phases in receiving services in a way that they understand. You want to have a family-friendly environment, and that's physically and emotionally. It needs to feel welcoming and not so sterile. It needs to feel safe, so that when you feel more comfortable sharing information that is disturbing, that is intimate in nature, it needs to feel like a place that you are welcomed and that people are there to help you in the way that works for you. It also should show up in your materials and in the interactions that people have. regardless of whether that person is there who is answering the phone and checking people in, or someone is emptying a trash can. The way in which you interact with those coming to you for services makes a huge difference. We also would encourage you to track the outcomes that we were talking about and use that data in your continuous quality improvement processes, both for the program and for your organization. Check in with families, not just the one time to fill out a survey, but when you make changes. How is that now coming across to them? Let them know how you're using the information that they've shared with you and that it is making a difference. Next slide. So this is just one of multiple ways that you could show this, but you want to find a variety of options for families to be involved. Depending on what's happening with that family, they may or may not have time to contribute in different ways. And so this table lists the number of ways that they can do so. They can inform the things that you're doing, like your website, or be part of open houses when you're developing your materials. They can also consult by using focus groups to find out how things are going and what might work better for them. They can be interviewed. They can also be involved to co-lead workshops or to be an expert panelist for a training you're doing. They can collaborate with you in advisory groups, doing support groups, being part of advisory councils. And then you can also empower those families that are ready to take that next step to be a peer support provider, or to join as a representative on a steering committee. They can become leaders. You can help facilitate that growth in leadership so that they can represent family voice in a number of different ways. I do want to point out at the bottom of this table, in the green arrow, this is what is required for it to really work for you. There has to be safety, there has to be transparency and trust. People have to be empowered to use their voice. They have to have a choice in what they're participating in and fully collaborate with each other. Culturally responsive, peer support to help new people, and also mutuality. Next slide.
So, what worked and what didn't work when it came to that organizational level was what worked was collaboration across teams, in true collaboration. When everyone came together and shared their ideas or our ideas and worked towards the same goals, not doing it in segments or separately. Also, inclusive decision making meant our voices were heard and we were part of the process, not just informed after the fact. Resource sharing made a real difference, connecting us to tools, information, and support that we actually needed, not just, hey, here's a resource, even if you can't utilize it. And when the environment was family friendly and the processes were family driven, we felt respected, valued, and supported every step of the way. And like Millie said about the family friendliness, it's emotionally, it's physically, it's visually, it's all those family friendly things that you can think of. You as an individual, put yourself, do you like going into places that are not very warm and welcoming? And then, I apologize. Some things that did not work was a lack of coordination that sometimes left us repeating our story to different people and losing valuable time and possibly losing valuable information on the other individual's part, right? Because I've told this story so many times, and my child and youth has told this story so many times, we forget who we told what. So you lose valuable time and valuable information. And then rigid systems that made it hard to adapt to our unique needs as a family. And then staff that didn't always have enough support themselves, which impacted the help they could offer us. And then one of the hardest challenges was a failure to address stigma, those unspoken assumptions that can make us feel judged rather than understood. Next slide.
So going back to the Menti poll and asking, are there other ways to do this at the organizational level? Or are there some things that you're doing now? Have you already intentionally created spaces that are safe and comfortable for families, processes that are comfortable for families and that meet their needs? Are you looking at the families as having unique needs? It's not cookie cutter services. It's not just because a kid got angry, they need anger management classes. What exactly are you doing now? I'm going to share my screen so we can see the results. Okay, so you can go to menti.com, or you should be able to just stay on the same link that you were at before.
And you can also put it in the chat because I'm watching that, so I can share.
What are some things that you are already doing? Because as we saw in the very first Menti poll we did, you're doing some of this. I mean, some of this, I was trained clinically to do some of these things, but I've also learned a lot from the families I've worked with about what works and what doesn't. I like that, being very planful, creating spaces where employees can, they feel trusted and included. What about for the families coming in? Motivational interviewing is a wonderful technique that's readily accepted when you're using that type of approach by youth and families. And really kind of getting down to what's the unique thing that's happening with this family, and how can you leverage their strengths to address what's going on. Are there others? We had a young person choose pictures for our website so that it was representative of young people out there, not just what we thought, but they were actually part of designing that.
We have, we use motivational interviewing, and then someone said that's why relationship is so important. You can tell when someone needs anger management training, or whether it was just the type of anger we all express if we know them.
Office remodeling includes being more family friendly. I found it's helpful just to ask families, hey, when you come in, what's your first impression? What does it look like? Do you feel comfortable sitting down? Do you feel comfortable talking? Were you greeted? Just asking things like that. And then involving like a focus group. Our state, I live in Tennessee, and our lead family person at the state level does listening sessions every 6 months with families across the state to ask them how it's going. What are they getting that's working and what's not working? There's lots of ways that you can do that. Okay, thank you for that. This will remain open if you want to add something else. Okay, next slide.
So at the system level, one of the key steps in improving systems is to include tracking, measuring, and reporting on outcomes in funding contracts and grants. And this makes sure accountability is built in from the start, that mechanism for family-driven is there. And then you have to prioritize funding for programs that not only focus on these outcomes, but actively work to make them happen, because funding should follow what works. We also need to model family partnership and family-driven care in everything we do, whether that's in collaborations, projects, policy development, or funding decisions. This shows others what is possible. So modeling that. Someone is eventually going to pick up on it if we are modeling best practices. And then promote accessibility of services and practices that are family driven. And this is essential, that these services and practices must be easy for families to find, use, and benefit from. Not just find and not just use, but actually benefit from them, especially if they are family driven. And then we should encourage best practices through clear contract language, strong requirements, and consistent guidance from both state and system level. That way, family driven care isn't just a goal, it's a standard. Next. So, what worked well and what didn't at this level? What worked well was starting with the outcome tracking and reporting. When progress was measured and shared, we could actually see a difference that is being made, right? When it was shared in a way that we could understand and see movement forward. Also, encouraging best practices meant families we received care that reflected what worked in the real world, not just at the system level. And then prioritizing programs that were truly family focused kept our needs as a family at the center. So not being a one size fits all, like we had mentioned earlier, but individualized for us. We also saw the power of modeling family partnerships when organizations worked with us, not just for us. The results were stronger. We had trust there. We could work together. We were good partners. And then accessibility of services made it possible for us to get the help we needed, and then to staff to have the training that they needed, that then in return they were able to support us effectively. But as in the way the world works, there are things that did not work for us. Inconsistent outcome reporting made it hard to know if changes were being made. Like Millie said earlier, see what it is the families want or need and actually make that change. Have that change be visible, or not just asking for our input, but actually doing the work behind that. And then vague contract language that left room for interpretations, which sometimes meant less accountability. And then funding that wasn't sufficient enough to meet the needs of our real needs as a family, or real needs of the provider agency. And then families not always being fully integrated into policy decisions, which meant important perspectives were missing when changes needed to be made. And then there were barriers to accessibility that kept families from getting help, and the lack of ongoing support for the staff meant that even well-trained providers or support struggled to keep up with the family's real needs. Next slide.
I'm sure you're all surprised that, yes, it's another Mentimeter poll. What are you doing now at the system level? So I'm going to share my screen, and we're still on the same link.
And you
What
can
are some
chat.
What are some strategies at the system level, and what are you doing now? And as you're thinking about putting that in, something I've seen work really, really well is do some resource mapping. Where are you spending your money? And then ask families, are these the things that are working for you? That can lead to some difficult discussions about moving funding around. That doesn't make providers happy always. But if money is being put into something that doesn't work for families, then it's not working for anybody. And so that's one of the strategies I've seen at the system level. So anyone involved in anything around system improvement. And that can include if you're part of like a CMHI initiative, which is System of Care grant. Started a family-driven initiative to make people feel like they are part of. Oh, I love that. Like,
I do.
it's them too.
Mm-hmm.
There should be some ownership all around. So for anything that is happening in your community or your state around this.
Someone said collaboration with other providers that can help individualized care.
Absolutely. Particularly with transitions in care, because that is so difficult for families. As providers, we know behind the scenes what happens, how referrals happen, how everybody does it a little bit differently. But for families, it's like moving from one country to another. There are different languages, different acronyms to learn, different processes. So that collaboration is a big piece. And it is one of the things that came up as an important outcome. Seamless transition. Okay, well, people can keep adding to this. I want to make sure we have a chance if there are any questions. I'm going to stop sharing. And if we can go on to the next slide. All right. So it's really important that you get involved and you really partner with youth and families to ask them what's working, to ask them for their ideas. This is similar to the initial slide that I showed you that had all the information about the outcomes that happen when you truly partner with youth and families. This one shows that there are at least 50 ways that you can do that to get to the outcomes in each one of these areas. And so this lists specific concrete functions that you can infuse into what you're doing for families that get to system level outcomes, that get to community level, managed care, not just the youth and families, for your agency. So these are ideas, they're by no means the only ideas out there. It should fit what you do, where you live, the families you serve. But hopefully this is something that kind of gets you started. Next slide. And we really encourage you to share and to use these outcomes. There are links on the slide, and when you get it, share them within your community and within your state. We have been sharing these both nationally and internationally and encouraging people to use that at every level. So there are the outcomes that matter graphic, and that has a link that goes to a description of each one of those. There's a project brief. And there are 2 articles that are out and a third one in process. One goes a little bit deeper into those caregiver outcomes. One goes into a little bit more detail about caregivers and youth. And the next one will be in depth about the youth outcomes. We encourage you to use them when you are developing your evaluations of your services and with your staff to inform how you approach things and how you practice your craft, because it really is, it's a craft, the approach that you take to achieve those outcomes. And then when you're taking a look at what you're doing and is it working, is it not working, where do we need to improve things, what tweaks are needed in your CQI processes, keep these at the forefront. This is what is important to youth and families. And if we can focus on those and have approaches that go toward that, then we are going to reach the outcomes that keep families engaged in services, which means that we're going to have youth and families that thrive instead of just survive. So please use them, partner with each other to use that, partner with your youth and families and your family-run organizations. Get involved in research and evaluation to really promote what matters to youth and families. And to that, I think we have enough time if there are questions and comments, sharing of ideas. This is our contact information if you'd like more info on the study or any of these approaches.
I think we've only got one comment that says this has been great and very helpful.
I hope it is useful information.
If you have questions, put them in the chat, please. And I am just going to go ahead one slide, hopefully to give you a minute to put the questions in, but for the sake of time, the first number 1 box, please do complete our survey. We have a few minutes, so you could even do it now while you're still with us and remember to do it. You can scan the QR code. Or Sarah, if you could, I don't know if you can put that link in the chat for me. And then just encouraging, we have this information that was covered today. We have it on our website as well. But again, all these links will be shared with you in the follow-up email. And if you have any questions specific to the National Center, feel free to reach out to our director, Mary, and sign up for our newsletter because we are going to be doing these webinars on a monthly basis. So if you felt like today was a great opportunity for you to learn new information, please stay tuned for future webinars.
Thank you, Francine. I see I'm going to share with multiple people. Please do.
Yes.
Please do.
I'm not seeing any questions come in through the chat.
I am chuckling at the closed caption, though.
Yeah.
Yes.
I tried to figure out how to turn it off, and it just didn't.
I was actually reading it when I first started. I was like, did I say that? No, I didn't say that. I didn't say that.
Well, as we wrap up, folks, please do complete the survey. It's short. It won't take you more than like a minute. And we value your feedback to help us develop future webinars. And I just want to say thank you to Millie and Stacy for this excellent presentation and for sharing all of the valuable research and information. It is key to the work that we're doing at the National Center of making sure that families have access to the services that they need and achieve the outcomes that are most important to them. And specifically for the families that have experienced child welfare, often have access to services that maybe just aren't quite right for their own unique needs. And that's what we're hoping to improve. All right, folks. Well, please do one last plug. Can you tell that I really value your feedback? Please do complete the survey. And when you're done, the webinar has concluded. So thank you. And I hope you all have a great rest of your Thursday.